In this lesson, you'll use a tool called a decision-making chart to explore more about how you make decisions related to COVID-19. Living through a pandemic has complicated our decisions, so it is helpful to slow down and consider the reasons behind our decisions. We'll use a decision-making chart to evaluate the pieces of the decision, including what you've learned about the science of the virus and your own contexts and values. You'll also talk about how decisions can change based on the context and how everyone doesn't always make the same decisions. Let's walk through an example using the decision-making chart. The things you use to make decisions are what we call criteria. You can see some criteria that you can use to make decisions. In this example, we have 3 criteria: physical needs, social and emotional needs, and science. If your class thinks of other criteria that they use to make decisions, you can add additional criteria. The first criteria is physical needs. There are some things that we need physically to help us be healthier and survive, like food, water, and shelter. To help us make decisions, we can think about evidence and reasoning. Let's think about our evidence and reasoning for going to the grocery store. Do I need to go to the grocery store to help meet my physical needs? Does food help me be healthier and survive? Discuss the evidence and reasoning for the decision of whether or not we should go to the grocery store. You might say that you need to go to the grocery store to buy food because you need food to survive. Your evidence for that is that when you don't eat, you are tired and you can't concentrate. So based on the criteria of physical needs, you decide that you should go to the grocery store. Why might going to the grocery store be good for your social and emotional needs? Maybe you know that when you're hungry, you get frustrated or upset easily, or you can't concentrate. So if you're only considering your feelings, would going to the grocery store be a good decision? Yes. Why? What's your reasoning? You feel better when you eat and can concentrate better. What evidence do you have for that? You know from experience that you get upset easily when you're hungry. It's important to talk to your students about how people may make different decisions because you use different evidence and reasoning for your decision, and that's okay. For someone else, going to the grocery store may not be good for their emotional needs. Going to the grocery store may make someone anxious, so they do not want to go. Again, you may make a different decision than other people because you use different evidence and reasoning for your decision, and that's okay. Science. Your students have been learning about the science of the coronavirus, like how it spreads and how we can help keep ourselves safer. You'll draw on this learning to help inform your decisions. Ask your students to think about the decision, should I go to the grocery store? I know it's possible to get or spread the coronavirus there. What do I need to consider to decide if I should go? Students may bring up how it's possible for them to give the virus to other people, even if they don't know they have it. Some people are more at risk for getting COVID-19, and it is more dangerous for some people when they get it. There may be an outbreak in your community, or there may be lots of people who have been vaccinated. Fill out the science row based on your class discussion.
From this unit, my students learn that there are easy and difficult decisions. They observed their families having to make difficult decisions during the pandemic. They had to make difficult decisions about their physical needs, about their social and emotional needs, and how to be safe from the virus. The family tool was super helpful in this unit because they observed their families going through the process of how to make decisions using sound reasoning and evidence. Students are now able to use that in class.
For me, it was a summative assessment of what the students had been engaged in. That in the very beginning of the unit, we're talking about the emotional impact of COVID-19. By talking about the emotional impact, we validated it, and it was a really important part to get students to engage. And then after that, we engage in reading and research and writing and scientific investigation and data analysis and some social studies elements, community-based learning. And the emotional impact is there in different parts, but the decision-making sheet brings that component back and adds and emphasizes it. It adds a lot of weight to it. We're trying to succeed in a way that we as people in the United States haven't had to try to succeed in a generation or 2 or 3. So this is very unfamiliar. The sheet allows students and families to figure out, why am I feeling this way and what can I do next about it, on a very tangible level, to use evidence-based thinking, which is all over the standards and everything that we do. Use evidence-based thinking to explain what's okay and what's not okay. And maybe in the future, when COVID-19 isn't a threat, this is still something that students can engage in. It's still evidence-based argument in terms of how they live their lives.